You're welcome, sir.
Welcome. Please, now. Let Daddy sit down first before they will sit down now. Okay. While our chaplain will sit beside them at the high table. So, yeah, that's what. Doctor, over to you. Please, you have 30 minutes for this, 30 minutes.
Good morning, all the men in the house. So my privilege and honor to be here in your midst on the invitation of the All Men's Fellowship, the organizers of this convention. I'd like to thank the leadership of the Anglican Church and the LOC for putting this program together. So I've been told we're conscious of time. The topic is very apt, prostate health, what every man should know. The media team would help me. I have some slides to share, so we'll quickly run through them. It's something that, we all are affected, directly or indirectly. Even the people that support the men, the women and the children. So it's not only the man that should know about the prostate. Next slide, please. Next slide. So that's our topic for today. Next slide. I have a brief outline that I would follow. Next slide. Next slide. Now, we need to know a bit about the prostate. Next slide. Thank you. So the prostate is an organ that all men have. And like Dr. Fakaya has already told us, it's a reproductive organ that is in the bodies of men. Now, this organ is located somewhere close to the bladder. It's just below the bladder and then in front of the rectum, which is the part that connects to the anus. Now, because this organ is close to the prostate, as a man gets older, basically from the age of 40, the organ starts to enlarge. So most of the common problems that we're going to look at today will be issues that happen to men above the age of 40. But what does the prostate do for a man? So it produces secretions, or the seminal fluid, the water that carries sperm out of the man's body into the woman to achieve conception. Now that water that comes from the prostate is what nourishes the sperm and gives it vitality. So when men don't have a prostate any longer, or they are being treated for prostate diseases, this may impact on their reproductive life, which is a common thing that we get to answer and address when we are counseling men that have prostate issues. Next slide. Now, there are three very common prostate problems. So they are the things that I'll be looking at briefly this morning. The first one is called benign prostatic hyperplasia. It's a non-cancerous growth or enlargement of the prostate. It's common in elderly men or older men, and it may lead to urinary problems. Now, this is what I call a path of normal aging for all men. This one called BPH, or benign prostatic hyperplasia. It's not a factor of what you've done or done wrongly or what has gone wrong in your body. It is just physiological part of aging in men. So once a man gets to 40, the prostate gland that has been there since birth and quiet starts to get bigger and bigger. And it's not, again, a matter of your age. So you can be 50 and your prostate gland might be bigger than a man who is 90. It's just specific for every individual, your DNA. Now, the next one is prostatitis, which is an inflammation of the prostate. This, again, is common, not in the too old group. This happens more in the people who are sexually reproductive, sexually active. So in the younger age group, so men in their early 40s, maybe early 50s, are prone to having inflammation in their prostate. And this inflammation could either be bacterial in nature or non-bacterial. So it could come from maybe infections like urinary tract infections that a man might encounter during sexual intercourse. So this is a simpler and more straightforward entity to treat. Now, the last one, which is actually the big monster, is prostate cancer. Now, prostate cancer is one of the most common cancers in men, and we will delve more into issues about the risk factors and how we can try our best to be on top of the game so that we don't have prostate cancer. Even if we're going to have prostate cancer, let us have the knowledge that it can be dealt with and you can be a survivor of prostate cancer. Next slide. Good. So prostate cancer is a public health concern, especially among black men. So it's something that has been found to be more prevalent and more aggressive amongst blacks. Globally, it's an issue with men, but in the black race, we have a bigger challenge with the kind of cancer of the prostate that presents. It is the second most frequent cause of cancer death globally. That's after lung cancers. In Nigeria, it is the commonest cancer that is diagnosed amongst men. In fact, it's said that 1 in every 10 men stands a chance of developing prostate cancer in a lifetime. And in a day in Nigeria, the current statistics have it that about 26 men die from prostate cancer on a daily basis. So this is why I say it's a public health concern, because it's a burden not only on the patient, the family, even the system, the health systems, and the economy suffers the burden of this big problem called prostate cancer. Unfortunately, in Nigeria, we still have a problem with late presentation. Late presentation in the sense that people come for help when this cancer, so to say, has become advanced. And that limits the potential for curing the man at that stage. At that stage, we only have to, manage and palliate the man's problems and suffering so that, he can still live and have a peaceful remaining days or years of his life. Next slide. Again, about prostate cancer, the natural history is that 2 categories. Some may be very slow and indolent in nature and in growth, while the bad ones are the ones that progress aggressively. Now, if science was able to detect the people that fall into the aggressive cancer group, that would have been excellent. So you just target them and then give aggressive treatment. But unfortunately, it's because we cannot tell from the start if a man is diagnosed of prostate cancer that this is the indolent one, while this is the aggressive one. So because of that limitation, we rather prefer that everybody is checked as much as possible. If you're in the risk category for this disease, you have to be checked so that once you're picked and if there's anything that needs to be done early, it can be offered and it could be potential cure for such a patient. When we say slow and indolent, prostate cancer has a huge latent period, 10 to 15 years. It could be quiet. So it's not one of the cancers like breasts that can be very aggressive and within months or just few years, people succumb to things like breast cancer. For the prostate cancer patients, it could be very, very quiescent and slowly growing in the system. So at times when we see people that are coming with prostate cancer, it has started 10, 15 years ago, and because of our poor attitude to health care in our country, for instance, people don't check, they never picked it at the time of inception. The aggressive ones, like I said, are the bad ones, but luckily the slow and indolent ones are more common. They're about 2/3 of the prostate cancers, while the aggressive ones constitute 1/3. That's 1/3. Next slide. Symptoms of prostate diseases generally. So the symptoms initially could, not be specific for cancer or the benign one. So we could have things like difficulty with urinating. It's either the man has difficulty in